I am Dr. Vishnu S Reddy. Sudden sensorineural hearing loss. This is a very important topic, and why? Because when any patient who loses the hearing suddenly, all of a sudden, because of various causes, usually it may be a viral infection. It can also cause giddiness and ringing sound in the ears, along with the sudden deafness to some of the patients. And the other causes, usually the vascular occlusion, blood supply may be cut off. People with diabetes long standing and hypertension and other associated comorbid medical conditions also sometimes can cause sudden hearing loss, and also it can be idiopathic. That means we don't know the cause. That's how also some patients can present, or some of the medication like the autotoxic drugs, some drugs like aminoglycoside drugs like kanamycin, and usually these aminoglycoside drugs are given in critical care setup where there is patient is suffering with bacteremic shock, and these patients also can present with sudden deafness, along with the diuretics. People undergoing the dialysis for kidney failure can also come with the sudden deafness. So whatever is the cause for sudden loss of hearing, should be approached ENT surgeon as soon as possible, because this is like a golden hours. 24 to 48 hours after losing hearing is the best time to treat the sudden hearing loss. Usually on clinical examination, the tympanic membranes, eardrums will be normal. While doing the patient audiometry, pure tone audiometry will show sensorineural deafness. The nerve deafness is diagnosed by doing audiometry tests. Then we will know the severity of the hearing loss, whether it is mild, moderate, severe or profound deafness. It can be diagnosed by pure tone audiometry. Once it is diagnosed, the treatment should be currently the intratympanic steroid injections, ideally dexamethasone. See, these patients should be given the dexamethasone instillations into the middle ear through the tympanic membrane with a fine needle under microscopic guidance. This will be given in the ENT outpatients. So that will help the corticosteroids to get absorbed through the round window membrane, which is the entry to the inner ear cochlea, where there may be inflammation or hair cell damage in the cochlea can cause the sudden deafness, which is a kind of emergency. Earlier the better when you see the doctor. So ideally, if you give this transtympanic instillation of the corticosteroids under microscopic guidance, usually we give the injection by putting some local drops in the ear canal, leaving it for 10-15 minutes to numb the ear, and under microscopic guidance with a long thin needle, 26 gauge needle, we through the tympanic membrane we instill about half an ml. It won't, we can't give more also, so it will come into the throat or it will come out. The whatever you half ml or less than an ml, 1 ml, the corticosteroid will get absorbed into the inner ear, and it has an anti-inflammatory effect on the cochlea, and this can reverse the problem, and the severe to profound deafness also can become normal within with one or two instillation of the corticosteroids. This is considered an emergency, because if the patient approaches late by taking various other medicines, and if they approach late, particularly when it goes beyond 3 weeks, then the no medication will work. Then it will be irreparable damage where the patient may end up based on the severity a hearing aid, or they may need cochlear implant surgery if it is severe to profound deafness. To prevent all this, when anyone who loses hearing, should approach the ENT doctor, and then the audiometry should be done and the severity of the hearing loss should be identified. These patients can also have some ringing sound in the ear and associated giddiness sometimes. These symptoms also can be addressed, and the hearing can be saved by giving this transtympanic or intratympanic dexamethasone instillations, which is very, very essential. The olden days we used to give oral corticosteroid tablets which will have to absorb and reach the inner ear. The concentration was not adequate. Now directly we are giving into the ear, which will certainly have a better concentration, higher concentration to reach the inner ear and to reverse the problem and to cure the sudden deafness. So the message here is, whenever the patient loses hearing, you should approach the ENT surgeon immediately, which the diagnosis can be made, and the hearing can be, you can get back your hearing if you approach the doctor immediately. But it is not going to help if it exceeds beyond 3 to 4 weeks time. The results may not be good and you may be helpless to get the hearing back to normal.